Not only is diabetes a prevalent disease in our modern society, it has also been a condition familiar to many generations before. Diabetes is no stranger to history. Although it has been documented for many years, it has only recently become a common problem among our population. Estimates suggest approximately 380 million people have diabetes worldwide, and this number is only bound to increase. An important distinction must be made for newcomers to the subject. There are two main types of diabetes. Type 1, commonly referred to as insulin-dependent diabetes, and type 2, also known as non-insulin-dependent diabetes. The main difference between both types being there is an insulin deficiency for type 1 and an insulin resistance and failing insulin secretion for type 2. A fairly large number of people, approximately 90% of all cases, have type 2 diabetes. Let us take a further look at type 2 diabetes. Both types are characterized by a chronically high level of blood sugar, a risk factor for a host of health problems. In the case of type 2, cell membrane transporters that act to take in blood sugar from the bloodstream have developed a degree of resistance to the hormone insulin. Insulin is secreted by the pancreas in response to high blood sugar, commonly after a meal. In the presence of insulin resistance, more insulin needs to be secreted in an attempt to control blood sugar in an environment where the body struggles to maintain basal levels. High levels of insulin secretion also poses its own problems, namely being a risk factor for obesity due to the hormone's fat storage effect. Treatment for type 2 diabetes focuses around active control of blood sugar levels. Typically, physical activity and healthy eating are the main factors needed to be exercised for ideal disease management. Some type 2 diabetics need injectable insulin to help their body control their blood sugar level, but this can lead to problems. Our bodies are complex systems, and with incorrect timing or too large a dose of insulin, this can lead to complications. In these situations, the opposite effect, hypoglycemia or low blood sugar, can occur. There is no cure for diabetes, although it can be controlled, and the complications can be avoided. The first step is to make some lifestyle changes, but the best way is to stop type 2 diabetes before it starts. Increased physical activity and weight loss are the safest, most effective and preferred means for correcting this metabolic imbalance. Exercise will decrease insulin resistance and improve its efficiency, while making improved food choices will greatly improve your body's ability to manage blood sugar.